Meeting is being recorded.
Good afternoon. Thank you so much for joining. My name is Frank Ordway, and I'm joined by Nicole Rose, and we're here with the Department of Children, Youth, and Families. We tried to host a webinar this afternoon to give the child care community updated information about the coronavirus and our state's response to it. So many people logged on that it candidly crashed the system, and so sorry for the inconvenience for those of you who tried to reach us on the webinar platform, and we'll do our best to try to either get something that allows that many people to log on by next week, or something that allows us to have a better conversation here with all of you. We'll be providing you some contact information to send your questions in at the end of this video, and we encourage you to do so, and we will turn around both individual responses as well as FAQs that we post for everybody as quickly as we can. I'm going to cut to the chase. Obviously, there's been a lot of developments in the last 24 hours with now a statewide school closure here in Washington State and a national state of emergency that has been called by President Trump. Right now, we are still following the CDC advice and guidance and the advice and guidance of our Department of Health and encouraging child care providers and ECAP providers to stay open. We understand that this is a particularly stressful time, and this is a very difficult thing to manage, but right now, our best advice is for you to stay open and practice your good hygiene practices that all of you do already. Just really double down on that effort and do your best to keep your kids safe, but we really do encourage you to stay open. We are trying to provide and explore a number of ways to make this easier for you to administer. The legislature just wrapped up its business earlier this week, and they did a lot of things there that are going to help us. We are going to have rate increases for all of you. At the minimum, you'll be at the 65th percentile for all services in your area. We are going to be working as quickly as possible to get to an average monthly rate for all of you. There's a foster care child subsidy increase, as well as some copay relief. All of these things will be coming online in the coming months, and we hope that makes it easier for you to stay in business. And we're also doing some things to try to give you some relief in the short term, and I'll turn that over to Nicole to educate you on those things. And I want to tell you about an email address. It is dcyf.communityengagement. Sorry for the length, everybody. dcyf.communityengagement@dcyf.wa.gov, and so please use that for the time being with all of your questions that you're going to have that we don't answer today on this video. Nicole, why don't you talk about the amazing work that you've been involved with in the last 48 hours and the things we're exploring to try to provide providers with as much relief and flexibility as we can.
Great, thanks, Frank. So here at DCYF, we have stood up a team that involves folks across licensing and our eligibility and provider supports division to really look at ways we can encourage providers to maintain their existing child care capacity, and also ways that we can safely expand access to child care for our children who are now facing not being in school come Monday. So some of the things that we are looking at in this is really creative thinking around flexibility in meeting licensing regulations, and things that we want to consider there are seasonal camp models, ways we might look at physical space differently, allowing providers to increase their capacity, and looking at staff ratios. In order to do some of that, we understand we have to have a waiver process for providers, and so we are actively working on that and should have more information on that soon. One of the other things that has come up is, what does this mean for a provider that accepts subsidy? So what if my center or my home closes because I need to disinfect for a few days? Will I still receive payment? What if my center or home closes and I'm going to be closed for an entire month? What will payment look like? What I want to let you know is that we are actively exploring those questions and answers. We understand that continuity of funding is really vital for businesses in this important time. We're also taking a look at how we might recruit and deploy other qualified staff members who could come and provide care, maybe in an alternate setting, and thinking about how we can streamline the background check process in order to have that happen. Again, as I said, we want to think about ways we can expand safely, and part of that is thinking about some of those basic health and safety requirements. Also looking at ways we can access first aid training and CPR training online. We're also hearing the need for a centralized space to have information about openings so that families have a place to go to see if there is childcare available in their area. So we're working with some partners today on a way to understand the capacity that exists in the current system and a way to share that information with families. I think it's really important for this group to also know that we are coordinating closely with OSPI during this time. These are our partners in this work, and not only are we coordinating with OSPI, but having conversations with school districts as we navigate this. One of the things we would really like to see is that if there are programs that operate in a school building, that the schools continue to allow them to operate there, whether that is an ECAP program, licensed childcare, or our before and after school programs. You might also be asking yourself, if I was serving a school-age child and I just had them before and after school, what does this mean now that I might be serving them full day? And so we're exploring ways to administratively look at increasing those authorizations. I think the things that I would say about this is that this is an actively changing situation. We are engaging stakeholders to help us think through some of these tough questions. We will also need to think about how we prioritize access to care, not only for our first responders, but for some of our most vulnerable children and families. We also want to make sure that these children still have access to meals. So these are all of the things that we're thinking about as we navigate this scenario.
So again, we really regret the fact that the technology crashed this afternoon. We will do our best to try to create more of a conversation here. I am sure that you have a ton of questions that we have not answered in this short video. Again, the email to use, at least temporarily, is dcyf.communityengagement@dcyf.wa.gov, and we'll do our best to turn those questions around, both individually as well as in an FAQ format for the entire community. But right now, our advice, again, is to do your best to stay open and practice all of the good hygiene and cleanliness things that you're hearing about both in the news and from the CDC. Keep your eyes on the CDC and the Department of Health website for the most up-to-date information, and we'll be back in touch as quickly as we can. Thank you all for watching this video, and stay in touch.
Thank you.